Hi there, I'm Dr. Sophia Capo, and this is another episode of One Clear Vision. Joining me today, I am super excited for a conversation with Dr. Vanessa Bedard. Welcome, Vanessa.
Thank you.
She is a pediatrician here in Kelowna, and our conversation today is going to be focused on screen time and specifically how much screen time children should have, whether that's related to anxiety, depression in kids, and so many other fun things. So we're going to get started by just looking at, what is a pediatrician? Let's start from the basics. Can you tell us what's a pediatrician? How is it different from family doctor?
Yeah, I think that's a great question. So pediatricians receive specialized pediatric training as opposed to family physicians. Where family physicians obviously receive pediatric training, but they also have to undergo other training for the rest of the life cycle. So here in Canada, the residency program after medical school is 4 or 5 years. And specifically to BC, the majority of pediatricians are consultants. So for anyone who's actually moved from Quebec or Ontario, you'll find that's a huge difference because the pediatricians there actually see almost every single child. And here, that job is taken up by the family physicians.
Gotcha. So that's how I grew up in Ontario. And I had a pediatrician just instead of a family doctor until I turned age 18. And then I got pushed over to a family doctor. So you're saying here in BC specifically, as a pediatrician, you only consult on certain cases. So how does a kid here in BC get a pediatrician?
That's also a very good question. So most of us are referral basis. So a primary care practitioner, a nurse practitioner can refer. If you do bring your child to the emergency department and there is sort of need to see a specialist, then we also do see children there and take care of the hospitalized kids also.
Okay. So it's like you did your undergraduate degree, medical school, and then a residency that was 4 or 5 years long, just in pediatrics. And now if someone wants to see you, they need to get a family physician or a nurse practitioner to refer to you for a specific case.
Yes.
Okay. In your practice specifically, when you're working here, are a lot of the kids that you're seeing and talking to on social media?
I would say yes.
Yeah, almost all of them probably. Have you come across any kids now who are like completely screen free?
I don't think I asked that question, so I do not know.
That's fair. I've come across maybe 2 or 3 now because in the children's optometry world, sometimes I just need them to look straight ahead while I get my work done. And I ask a kid, what do you want to watch on TV? And the parent will say like, oh, they've never watched TV before. And I'm like, you're such a great parent. How do you do that?
It is challenging, yes.
So what are like the guidelines? Are there guidelines specifically in the pediatrics world about how much screen time a child should have?
There are. So I think generally this is a very, I love the fact that we can actually talk about this because I think there's a lot of misinformation out there.
Okay, let's clear it up.
Yeah, and I think there's also sort of a personal aspect to this as well, right? But what I'm going to be talking about comes directly from the Canadian Pediatric Society.
Okay.
And there are clear guidelines on appropriate screen time for children that between ages 0 and 4, and then there's the school age children. What should they be watching, and for how much? And then obviously teenagers. So there are differences depending on how old you are. And we will be providing the link to the information that I'm going to be talking about. So that will be available. And I'm going to be referring to some of the information directly from their position statement.
Sweet. So let's start then with like the 0 to 4, because I didn't know, you said there's guidelines for how much they should be watching, but also what they should be watching. Okay, yes. So let's go 0 to 4. What are our guidelines?
What is what? Generally, and I think this is actually a really hard thing. I'm a parent myself, right? My kids are a little bit older. They are attending school now. But, after sort of looking at this again today, I did a bit of some personal reflection. And I feel like I might have not met the guidelines exactly.
Okay, that's okay.
But generally speaking, there actually is no real benefit for kids less than the age of 2 to actually be exposed to any screen.
Okay.
So that might seem a little hard to do and almost impossible.
Yeah.
The reason behind that is that those children learn best with face-to-face learning, interactions, social connections. So when you actually put a screen, you lose that real interaction.
Okay. So it's almost, would you say it's like detrimental to be on a screen when you're under the age of 2?
So
if we're losing, if it's replacing that social interaction?
So I think, and this is sort of obviously where there's a lot of gray. So if you're looking strictly to understand how, and we're talking specifically about children less than the age of 2, and you could probably expand it a little bit for 3 and 4-year-olds, but they learn through connection and relationship. Now, is it harmful if it happens?
Yep.
That is a question. The evidence actually shows that babies less than the age of 1 do not retain any content.
Oh, okay.
Nothing,
That makes
right?
sense.
That's provided from a screen.
Yeah.
Even if it is labeled age appropriate.
Oh, okay.
Now, they can be distracted. They're distracted by the sound, the colors, the shapes.
Yeah.
Now, as you get closer to the age of 2, some children are actually able to transfer what they see, so mimic behaviors, emotions, maybe even words, and they could transfer it into real life.
Okay.
However, learning literacy primarily, working on attachment skills with parents, laying the foundation for self-regulation and executive functioning happens best when there is communication with a real life person. Now, it kind of sort of goes a little bit back to the content of what they are looking at. And there is there's a plethora of apps and TV shows that are out there. And as much as I am saying from a learning point of view, there really isn't any need for children to be on the screen. There are age-appropriate content that has been shown if it is done in a collaborative fashion, if a parent can be close by, if there's repeating, then yes, it can help with literacy, word formation.
Gotcha. But would it necessarily be better than the in-person relationship connecting? It's just kind of could be seen as maybe it is doing similar things.
So I think this is sort of, if anyone wants to sort of get what we're going to be talking about, is that social media replaces something else, right? There is a loss of time with other people. Now, if you were to ask me specifically, can screen time or age-appropriate content in young children help them with literacy? The answer actually is yes.
Cool.
But so if we look at kids that might not have access, or maybe have parents that are not interested in reading or storytelling, there are interactive apps and ebooks that will, or even in an audio format, that will actually help younger children learn grammar, new words. So I think, if we look at this topic, there are specific benefits, but we have to sort of just be aware of the risks.
Gotcha. So it's more of like if it's replacing the good stuff, then that doesn't seem like it's super great. But if it's used with the good things, or in a way where you can use a parent and a program to supplement literacy or anything else, then it could be seen as, we can use it and we can integrate it into our learning with our kids.
100%, yes.
Okay, so let's go back to regulations because we didn't finish that.
Yes.
Under 2, you said 0.
Yes.
0 minutes. And then let's go 2 to 4, or because that's still before school age, but not quite 2.
I think, so I guess, that 3 to 4 age category, I think we're kind of talking about 1 hour.
1 hour a day, or 1 hour?
1 hour per
24
hours.
Okay.
And that is because what we actually want to, and it kind of goes back to what I said earlier, if you are spending a lot of time in front of a screen, and most of that is probably going to be in a sedentary fashion, it prevents you from doing other things that are important for your body. So another guideline actually that I would like to bring up is that there is a resource online here in Canada, and it actually talks about 24-hour movement guidelines.
Okay.
And it is broken down by age category. So if we look at 3 and 4-year-olds, they need to they need to be
the
getting
next
outside.
target actually is 2026 when they're looking for 26% of new vehicle sales to be elective
And that's
leave for
unfortunately-
qualified
we see the same
vehicles
thing in
the province.
optometry. Like,
And
we know that
then, of course,
children
2030
who
is
spend more time
90%, and
indoors are more
2035
likely to be nearsighted,
is
and more likely to have
100%,
their
as you
nearsightedness
mentioned.
progress. So it's the
Those
same.
targets are
It's not
coming up
necessarily
pretty
that,
quick and pretty
you know,
fast.
being
To
inside is
me,
bad or not doing it is bad.
90%
It's
is
just
pretty much
these benefits that we
100%,
get
and that's only
when
in
kids are
5
going
years. So
outside, when they're doing more stuff,
we've
and they're not just
seen
stuck on a screen. Okay, and then what about when kids start to get school age and older?
So obviously there probably really isn't a blanket statement,
Sure.
but what we are kind of sort of aiming for, and based on the Canadian Pediatric Society guidelines, is that you really want to be trying to have less than 2 hours per day
2 hours
of non-school based screen time.
Okay, so now this is recreational screen time. So like
Yes.
TV, video games, all the stuff in school that we do, because a lot of learning now is like in a classroom, children have iPads or they have their computers that they're learning with. That doesn't count.
It doesn't count it might count from an eye point of view, but
Sure.
from a development point of view, I think the content that is on screen at school is
Different.
curated, it's
Yes.
researched, and it obviously is targeted to learn. But we're talking primarily recreational screen time. So
Okay.
as you mentioned, video games, even TV, and social media, unfortunately, kind of leaks into there as kids get older.
Is there an age where you would say like children would be quote unquote allowed to be on social media? Now I'm talking like Instagram, Facebook, TikTok, like the more it's less curated and it's less patrolled, and it's hard to know what they're watching, what they're not watching. What do you think for ages?
No, that's a really good question. And now that is not in the guidelines.
Not in the guidelines.
You are going to be getting my personal opinion. And I think actually, maybe I should backtrack. There was a position statement that was put out by the Canadian Pediatric Society advocating that industries actually mandate stricter laws for social media, because obviously this is sort of beyond our control, right?
For sure.
I think the challenge is really in knowing why are children going on social media, what is the push, what is their experience, what do they get from it, right? My children are not on social media.
They're
as
not
of
on
yet.
social media?
No.
So your household policy is a little stricter?
It is.
How old are your children, if you don't mind sharing?
They're 12 and 8.
12 and 8. Okay, that's
I mean, I'm not naive. The day will come. But I think, and we could maybe get into it as well, once they are on social media, I think it's really important that as parents, so myself and my husband, actually have access to their content.
What they're looking at, like making sure that things that they see are appropriate. And if they're not appropriate, having those discussions about them
100%.
So that we understand what is appropriate and what's not appropriate. Yeah, it must be very difficult with household rules, especially because, you want to give your child a cell phone because they're walking to school and and once they have a smartphone, they have access to so many things that are hard to regulate.
Well, it's interesting that you bring that up. So our son got a cell phone for his birthday.
Oh.
It is the old-fashioned flip phone.
Oh, nice.
So it is a phone call and text messaging only.
Nice.
But that will probably not last forever.
Interesting. I've had a couple of families also say too that they have a smartwatch, and then instead of hooking up to a phone, they have it connected to cellular, and then the only thing they can do basically with their watch is phone call or look at a text if it comes in, but it's not actually connected to a phone or to the internet, which is pretty cool. There's been an increase in childhood anxiety, childhood depression, a number of children taking medications for these conditions as well. Do you think that there's a relationship between social media and screen time and childhood anxiety and depression?
So I think that, my personal answer is yes. I do think that there's a link. I think the danger in having these sort of general blanket statements is obviously sort of not considering individual factors. If we look at kind of general recreational use of screen time changes as kids get older. So earlier on, there probably is a slight interest in, I would say, maybe content that could be more knowledgeable. And then there tends to be a big shift in screen is recreation, screen is video games, and screen becomes social media. So I think and I'm happy to kind of go into details about it as well, but when we look at the relationship between screen time and mental health, I think it becomes sort of part of a broader conversation about the dynamics in the family. And if the viewers kind of want to remember anything from this conversation, is I think it's never too late to have a more family-centered approach to this and to start to feel comfortable to talk about social media, and not only social media, but screen time use. Now, part of the normal developmental phase of children is a desire to connect with peers. Definitely. It's a desire to understand and explore your self-identity, and there is a desire for autonomy from your parents. And guess what? Screen time and social media fulfill all of those, right? So there is evidence when children actually have healthy parent-child relations that accessing minimal or average screen times is beneficial in the sense that it can allow for peer connection and I guess I don't want to say self-discovery, but sharing your personal ideas and kind of listening to that feedback. Now, what could apply to someone might not give the same result to someone else.
Okay.
So generally speaking, I don't think the same rules would apply if the parent and child relationship is either more stressed or tensed. I think generally speaking, children that are socially isolated are prone to depression or actually suffering from depression and anxiety can have far more detrimental effects from social media and screen time in general. So even if we kind of sort of see that there could be a benefit to actually being able to connect with others in those particular circumstances, it actually emphasizes something that they do not have, right? So, and I think there's actually also studies to say, and this is kind of in these papers, is that children that are anxious and children that are depressed are far more likely to actually communicate with strangers, which is something that we definitely don't want, and are far more likely to experience negative personal effects after they've been on screen time. So feeling bad about themselves, wanting things that they can't have, and it just actually exacerbates some of the struggles that they're having.
So it seems like there's like completely separate groups, because in some scenarios it can be totally beneficial and like help with your social skills and with keeping connections with your friends and things. But then how do we know which kids are predisposed to be in that category? Like, how do we catch them when they're 8 rather than when they're 16?
And I think, that's another great question. And I think maybe the best approach to kind of have is to sort of try to have a very family-centered approach to screen time. So, and this applies to everyone, right? So being open about parental use of screen time, being open about what you actually go on, having conversations with children to sort of allow that understanding of why are you enjoying this game? What are you doing on this game? What do you like about it? Yeah. How does it make you feel afterwards? So I think when you're asking about is there a way to identify it, it's more about a longitudinal journey where you're really kind of trying to create a space at home that is safe, non-judgmental, because of course that'll add to the defensiveness of having to talk about it.
So it's almost you need to shape it from the beginning rather than let it get out of hand and then try and fix it.
Exactly. And I think if I were just to kind of maybe add a little bit, I'm going to lift this up. This is sort of going to be available as a link. So this is some of the information that is provided by the Canadian Pediatric Society, as I brought up earlier. And if you look at sort of very easy tools, because I think parents do feel guilty about...
Give us some tools, some real things that we can do.
No, and I think most people do feel guilty, and I think feeling guilty generally talks about, let's start a conversation, let's see what we can actually do. So they kind of list the 4 M's.
Okay.
So it's managing screen time, and this is primarily for like school-age children and teenagers, because we kind of sort of talked about, the earlier kids.
The earlier ages,
is a little bit easier.
Yes, it's easier.
And they're more amenable to actually parental limits. So the harder part sort of comes into what do you do as the kids sort of have a little bit more autonomy, and they obviously they talk back and they make their emotions, they make sure that they're heard. So the 4 M's, when it comes to sort of practicing safe, screen time literacy at home, would be managing their screen time. So if we look at this as we talk about kind of having a family media plan, so being able to set limits as to when is the internet actually being accessible, how much you're allowed to be on it, but also allowing for discussions about meaningful content. So that's the second M, meaningful screen use. So once again, through conversation, trying to understand, what do you like to do? What game are you playing? How does it make you feel? What are you getting out of it? And then, the third M, which can be the hardest, is modeling proper screen time use. So unfortunately, that can be a challenge, especially if people are more flexible with their work environment, right? You're accessible all the time based on technology, but modeling that healthy screen time use is really, really important for children. And I think actually it allows, if kids see that you are being honest about your relationship with screen time, they actually tend to be a bit more receptive to the fact that this is something that you're also struggling with, and you have to be vulnerable. And I think, the last M is monitor for signs of problematic screen use. So I'm going to maybe give a list of some general things, and I'm sure I unfortunately probably can say yes to a few of those, but it's if you're saying yes to some of these kind of problematic uses just intermittently once in a while, it's probably not necessarily representative of a major problem. But if this is happening over a consistent time, then that would sort of beg a conversation with a health professional, or at least start even with a friend, right? So the problematic screen use would be when you get a sense that children sort of feel bored or unhappy when they can't go on their screen. Number 2 would be they become very oppositional when parents are setting limits. 3 would be when, as parents, you see that their screen time is taking away from other things that are important. Physical activity, connection with friends, and even meaningful time with your family. And I think actually the 4th one would be when you see that your children kind of have negative effects from screen time as well. So once again, if you're saying yes to any of those, intermittently is probably okay, but more consistently, I think it begs
so is
a larger
this something
conversation.
that if they're noticing those issues, they should go to their family doctor, get a referral to a pediatrician like yourself, or is that go to a counselor or something? Where do we go?
Yeah, no, where do you go? I think starting the conversation with someone that you trust is really helpful, because I think the basic steps that any of the professionals will say is trying to understand the scope of the problem within family context. So I think trying to understand what can be, because if we're generally looking at behavior, right? So when it comes to any kind of behavioral therapy, it starts with trying to be objective, and children, some adults too, but children generally have a hard time being objective about their behavior. So, and who happens to point it out? Their parents, right? Yeah. And depending on the nature of your relationship with your parent, that could be a hard time or a hard conversation to have. So going back to who should be having these conversations, and I think really it is recognizing as a caregiver, as a parent, if you're feeling that there is a problem, and trying sort of some basic steps to start to see if you can have your child or your youth be a little bit more receptive to changes. Now, I think on a day-to-day basis, I would probably say that most families as a unit, if they employ the 4 M's that I have kind of talked about and that will be listed afterwards, probably should be able to manage most of these concerns. But remembering that this is not a quick fix. Sometimes it has to sort of happen consistently over time. So you do really if you're employing a new behavioral change or behavioral strategy, you have to give it several months, right, to see if it works.
And I think that's important to note too, because sometimes when like a family notices that they have this issue, it's like man, I really just need to fix this. And it becomes stressors on the relationship and many other things in the family. But to know, even from your perspective, what you're sharing is like, it's okay. And even you and your own family maybe don't follow all of those rules all the time, but to open the conversation seems like the thing that can be best for everyone when you're looking to start to manage the problem.
Yeah.
And not to be, I guess, ashamed of needing to ask questions of a medical provider or a pediatrician or a counselor or teachers at school to get more information about the behavior so that you can specifically address those things.
And I think, when you're talking about kind of, in talking to sort of different professionals or counselors at school, or obviously family physician or a pediatrician, is sort of when you're kind of seeing that the scope of the problem is enabling a larger concern. So is it feeling more anxiety, and all of a sudden is this anxiety level becoming so distressing that they're no longer able to function on a daily basis? Are parents starting to be worried about exacerbating depression? And I will probably say that in the larger context, as the kids that I've seen where screen time is sort of identified as problematic, it's more a sustaining element in a depressive episode, right? Yeah. So I think, once again, we brought up mental health earlier, but if there is if we're taking a pause and we're reflecting on our behavior in our family, and there's a concern about growing anxiety, deepening depression, those probably have a lot more urgency to seek out help and resources. And I should probably say I've referenced the Canadian Pediatric Society, but there also is a very good website through Kelty Mental Health. It's free. And there are lots of resources about mental health in general, but there's also resources on technology and how to start conversation around technology use and some basic steps to encourage a healthier relationship with technology.
Yeah, that's awesome. Yeah, we'll share that link as well. We love free resources. Because I get a ton of questions in the children's optometry world about screen time. Specifically, one big one is on blue light. So people ask me all the time, should my kid be wearing blue light glasses when they're on the screens? And I, of course, always bring up these same guidelines because I learned these in residency too. Under age 2, no screen time. After that, very little. And then, once we get to school age, we care more about the content rather maybe than the time. When looking at blue light specifically, we know blue light affects our sleep. And we know that sleep affects our immune system and our performance and everything else about how we're feeling throughout the day. And so from that standpoint, I always tell patients, no screen time before bed. Or we all have our phones now that have like some sort of a night mode or something like that. And those types of things do the same thing as blue light blocking glasses. So I wouldn't say that a blue light blocker is super necessary when you spend a lot of time on screens. Subjectively, some of the research tells us that, some of the research will tell us that we have people feel better subjectively when they're wearing their blue light blockers on the screen. But we don't actually have research saying that it's healthier for our eyes to wear a blue light blocker, but we know it affects our sleep. So if we decrease the amount of screen time, I usually say 2 hours before bed. What do you?
I think 2 hours would be ideal. 1 hour.
1 hour is more realistic.
More realistic. And I'm glad you asked that question because I was going to ask you the same thing.
About screen time before bed,
or about the blue light glasses.
Or about blue light glasses. Yes. Yeah. So using those certain shift modes on our devices, and then turning off our devices completely, even as a wind down before bed, I find is incredibly helpful. In terms of screen time and how they affect the eyes. Now, we talked in previous episodes about how the focusing system works in kids, and how every time we look at something up close, our focusing system turns on, and every time we look at something far away, our focusing system turns off. Now, throughout the day, we're constantly in an on-off position, and our system's being super flexible. But if we are staring at our phone, and we hold our phones pretty close, let's be real, here all day, that's really working our focusing system. And so sometimes what I see is headaches with screen time, headaches with close work. They feel almost like their eyes are pulling at each other. And this could be a sign, that their child has a non-reactive focusing system, or the focusing system isn't quite working the way it should. Or it could be a sign of a hidden prescription that maybe needs to correct it, that their eyes are working too hard. Another really interesting thing was there was a study that came out correlating, not not a cause. So we know the difference in our research. It's not necessarily that one thing causes the other. There's just an increase in how these things are coming up and presenting together. But between anxiety and focusing dysfunction. So people with more anxiety tend to not have focusing systems that work as well. And so I see a ton of patients in clinic with anxiety who then end up needing reading glasses, which helps them with their attention and with their focus. And then obviously spending more time outside. That's great for our well-being and great for our eyes because we're relaxing our focus and we're not looking at something super, super close. So from that standpoint, from a pediatrician standpoint, I want to know how important you feel like a proper pediatric eye exam is for the health of a child.
No, I think I think once again, it's something that most parents want to probably do more often, but they usually forget. I think it's exceptionally important. I think people can take for granted, or they can assume that their child sees well, and then realize that they don't.
I say it all the time, like kids do not know that they can't see.
Yes.
Or kids don't know that they're working extra hard to see until we fix the problem, which is funny.
So I think going back to like, what would you recommend? I mean, I think, right, like the dentist, every year would be ideal. I would probably say that there are some critical times where we really need to make sure that their eyesight is good. And I think the easiest one to remember is before they start school. Before they start
school, if they're struggling in school. I like to say before we do any sort of neuropsych testing or like before we start doing the learning disability testing, let's just rule out a vision problem while they're on that list as well.
And I think it's a conversation that I have a lot. I usually say hearing, vision, right? And when it comes to hearing, I think more people are actually worried that they're not hearing. So I probably refer a lot more families to get their hearing screened, and the majority of the time it comes back normal. But I guess from what you're telling me, and what I've actually really experienced even personally and also professionally at work, is that families, unless they're stumbling, falling over, really feel like they are the best judge of their vision. And I think sometimes they can be wrong. So a simple eye test is crucial.
Yeah, definitely. To just make sure that we're on the right track.
Yes.
Okay, before we end off, I want to know, just in general, and this can be about anything, what's just a common question that you get from parents a lot that you just want to share so that everybody knows the answer to?
Lots of, there are a few, but if we're going to tie it back to screen time, sure. I think, and I don't want to sound like I'm reiterating the same thing before, but I think it's really sort of important to know, the please do not do when it comes to screen time at home. A big one I would say is the background TV. Some families love having either that background noise or that distraction, but there is evidence to suggest that it actually increases distractibility. It increases even the quality of the parent and child interaction when there is something, even if no one is actually really paying attention to it, if there's just something that is distracting in the background. So trying to avoid having the TV on all the time. There are other sources of, you could be playing music, right?
Yeah.
And that still offers some background noise without being as distracting because there's no image. So trying to avoid the TV on all the time. Yeah. I would say practicing screen-free time, especially in those sort of important family moments. Mealtime is a big one as well. So trying to avoid the TV while we eat. I will say that we do this on a regular basis, but at the same time, because it feels like a treat, but at the same time recognizing that, mealtime is important with the family. It's a great time to share stories, experiences, build on social connectedness. So try not to have the TV on or any kind of device close by. So even sort of making sure that your own phone is placed away and you're not kind of sort of checking messages that are coming up at any time. Another big one is really making sure that there is no device in the bedroom. So
that's so hard.
It is. So I know, children's bedrooms, especially as they get older, is sort of a sacred space. They have their privacy. It's an important part of their autonomy development. But yeah, having this screen time is just almost like finding your Christmas gifts before Christmas, right? It's just that it is hard not to actually open it, right? So trying to avoid, and I mean, TV is sort of a more obvious one, but really taking away laptops, any kind of phone, portable game devices, taking them away from the bedroom. And it kind of sort of goes a little bit back to what I was saying about managing screen time and double checking the content, is that if you have kids utilizing media in public, well, not public, but in sort of spaces that are just, there's more traffic in the house, it begs and invites discussion and connection. Yeah. So I think when you're asking about certain things about trying to avoid, those would really be the big ones. I should also say, because you brought up the notion of sleep is something that a lot of people come and are concerned about. It's definitely something that I ask a lot, especially if we're talking about children that have learning problems, children that have attentional problems, behavior problems in general. Quality sleep is crucial for everyone, right? Regardless of the age. And I think there definitely is evidence to suggest that having a screen, even if people say it helps me to fall asleep, it increases emotional arousal. It suppresses melatonin secretion. It probably, whether we're aware or not, affects the quantity of sleep, because it just displaces sleep it replaces, falling asleep or a few hours of quality sleep with using a device. And it also increases the amount of sleep latency. So most people that do not have sleeping problems should be able to fall asleep within 30 minutes. An hour, you can, there's
so that's your definition of sleep latency is how long it takes for you
to fall asleep. So you're in bed, ready for sleep, lights out, and from that time until you're sleeping. Yeah. So most people, and this is a very common question that comes up, most people should be able to fall asleep within half an hour. And having a screen in your room or watching a screen an hour or even possibly up to 2 hours affects your sleep latency. So we didn't really talk about kind of what to do about that, but it is, I think it's a question, if anything, after this conversation, I'm calling on sort of a good objective review of our practices at home, because there are a lot of simple things that can make big differences if you do them consistently for a long time. And I know most people probably, by the time they come to see a pediatrician, are like, well, taking the TV out of the bedroom is not going to solve their depression. True, but these are kind of all crucial steps in, getting to a better state of mental well-being on a daily basis.
And it's from what I'm understanding from a lot of what you said today is the earlier we can create a guidance, a path that they can follow, the better our outcomes are going to be in the future.
100%. I think, that goes for anything. Modeling and setting good behavior earlier on in life usually translates to
most things, I guess, not just screen
time. Better
time.
Behavior later, right? It comes with its challenges, but and I think as much as it is exceptionally hard to have a conversation with a teenager to stop screen time.
For sure.
And it's not that parents are not trying when they're younger. It's just that it slips to something else. So I think and that goes, that's the challenge with all these sort of big blanket statements. It's not always yes or no, but it's a journey, right? So I think there might be times where you could maybe allow a little bit more, even if you're not up to the guidelines, but the guidelines are there for a reason. And I think having that time to review your practice at home is very important. And it helps for healthy discussions as kids get older.
Yeah, that is awesome. Thank you so much for coming on today and talking with us.
My pleasure.
We will see you in the next episode.